Welcome to the Whip Mix educational series featuring the Dinar 300 series articulator and Slidematic Facebow. Dr. Tony Daher is a board-certified prosthodontist, an associate professor, and past director of the Advanced Prosthodontic Program at Loma Linda University and a lecturer at the University of California at Los Angeles. Dr. Daher's practice is limited to prosthodontics and implant dentistry in Laverne in Southern California.
Today, articulators are easy to use and possess a high degree of accuracy. This will put the practitioner at ease in performing occlusal analysis and fabricating successful dental restorations. The purpose of this educational program is to demonstrate how to use Dinar 300 series articulators. I am Dr. Tony Daher, and after viewing this video, you will learn how to use the Dinar 300 series articulators. There are 3 models available depending on the degree of settings required. The Dinar Mark 300 series articulators are precision instruments manufactured to precise tolerances, giving you the highest quality and interchangeability. It is the perfect choice for analysis, treatment planning, and completion of even the most complex occlusal treatment cases. The level of treatment provided by clinicians varies from the simple crown and bridge case to the more complex full mouth restorative work. The Dinar Mark 300 series articulator is available with 3 different models, each with its own set of features to meet clinical and laboratory demands.
Each Dinar Mark 300 series articulator has the following features: built-in magnetic mounting system, built-in support pin which allows the upper member to stand completely open while the articulator is standing flat, elastic retainers to hold the upper and lower members together and assist in smooth operation during lateral movements, positive centric latch which securely locks the upper and lower members together when needed, or when released it allows the upper and lower member to be separated, designed to recline at a 45-degree angle for ease of viewing, factory calibrated to be within 20 microns of interchangeability. Let's begin by discussing the articulator relationship between the articulator and the skeletal anatomy. Overview of articulator and its relationship to the skeletal anatomy. The articulator is a mechanical equivalent of the lower jaw, a mechanical jaw, so to speak. To better understand the relationship between the articulator and how it operates like the lower jaw, it would be helpful to discuss the condylar paths of movement of the human mandible. In the lateral mandibular movement, the condyle on the side toward which the mandible moves is known as the working side. The condyle on the working side is rotating. The condyle on the non-working side, also known as the balancing side, produces an orbiting path down the eminence. Following this path in lateral excursions guarantees posterior disclusion of all balancing side inclines. We can see how the articulator reproduces these same movements. In a protrusive movement, the condyles move downward and forward along the articular eminence. The ideal functional relationship is immediate separation of all posterior teeth the moment the mandible begins its forward movement. We can see how the articulator reproduces these same movements. Most excursive movements produced by the mandible, as it works in harmony with its maxillary counterpart, can be replicated by using a semi-adjustable articulator such as the Dinar Mark 300 series. We will now take a closer look at the instruments in the 300 series. We can see how the articulator reproduces these same movements. Features of the Dinar 310 articulator. The Mark 310 is the simplest articulator in the 300 series. It features a fixed progressive side shift of 15 degrees and a fixed protrusive angle of 25 degrees. These angles were based on averages from studies involving more than 1,000 patients. A progressive side shift of 15 degrees produces a slightly more side shift than what is normally found in patient movements. By setting the lateral pathway at 15 degrees, any chance of balancing side-occlusal contact can be eliminated. Following this path in lateral excursions guarantees posterior disclusion of all balancing side inclines. It has no negative effect on any other aspect of occlusal harmony. Research studies and clinical experience has determined that posterior teeth should ideally be discluded the moment the mandible moves forward out of centric relation. Posterior disclusion can be achieved by the anterior guidance in the patient. Extensive studies have shown that this results in shutting off most of the elevator muscle contraction to reduce loading forces on the TMJs and the anterior teeth. The fixed protrusion angle of 25 degrees in the condylar guide gives it a flattened angle. Since protrusive contact on posterior teeth is never a desired result, disclusion can be achieved by setting the condylar path on a flatter angle than the patient's forward path. Setting the condylar path flatter on the articulator will result in faster separation of the posterior teeth if the condyles travel a steeper path forward in the patient. This has no effect on the function, comfort, aesthetics, or stability. You can use the Mark 310 for any type of laboratory work where average settings are appropriate. The Mark 310 is perfect for mounting your working cast, then transferring them over to the 320 or 330. The accuracy and interchangeability is obtained during the manufacturing process with less than 20 microns difference between instruments. Let's take a look at the Mark 320. The Mark 320 provides the capability of setting the articulator using a protrusive record. It features a fixed progressive side shift of 15 degrees and an adjustable protrusive condylar inclination ranging from 0 to 60 degrees. The fixed progressive angle is based on average from studies involving more than 1,000 patients. By setting the lateral pathway at 15 degrees, any chance of balancing side-occlusal contact can be eliminated. The ideal functional relationship is immediate separation of all posterior teeth the moment the mandible moves forward from centric relation. Extensive studies have shown that this results in shutting off most of the elevator muscle contraction to reduce loading forces on the TMJs and the anterior teeth. Setting the condylar path flatter on the articulator will result in faster separation of the posterior teeth if the condyles travel a steeper path forward in the patient. This has no effect on the function, comfort, aesthetics, or stability. There is never a problem with condylar guidance if the anterior guidance can disclude the posterior teeth in all excursions. If posterior disclusion cannot be achieved, it will be necessary to rely more on the condylar path to help separate the posterior teeth. In such cases, it is important to determine the condylar path. If necessary, the Mark 320 allows for this adjustment. It can be easily achieved with a simple straight protrusive bite record to set the protrusive angle. We will demonstrate how to set the condylar inclination using a protrusive record later in this video. Our final instrument to discuss is the Mark 330. The Mark 330 provides the user with the fullest capabilities in the 300 series line. It features an adjustable progressive side shift from 0 degrees to 15 degrees. An adjustable protrusive condylar inclination from 0 degrees to 60 degrees, and adjustable immediate side shift from 0 to 2 millimeters. The Mark 330 was designed for the most comprehensive cases seen in the dental practice. These types of cases usually require taking a face bow registration along with bite records that usually result in setting the instrument outside of the average settings. The ideal functional relationship is immediate separation of all posterior teeth the moment the mandible moves forward from centric relation. Extensive studies have shown that this results in shutting off most of the elevator muscle contraction to reduce loading forces on the TMJs and the anterior teeth. Setting the condylar path flatter on the articulator will result in faster separation of the posterior teeth if the condyles travel a steeper path forward in the patient. This has no effect on the function, comfort, aesthetics, or stability. There is never a problem with condylar guidance if the anterior guidance can disclude the posterior teeth in all excursions. If posterior disclusion cannot be achieved, it will be necessary to rely more on the condylar path to help separate the posterior teeth. In such cases, it is important to determine the condylar path. If necessary, the Mark 330 allows for this adjustment. It can be easily achieved with a simple straight protrusive bite record to set the protrusive angle. We will demonstrate how to program the different features the Mark 330 articulator using records later in this video. Assembling your Mark 300 series articulator. Let's begin by going over how to assemble your new Mark 300 series articulator. Remove the contents from the carrying case. The contents consist of a lower member, an upper member, an incisal guide pin, and a pack of disposable mounting plastic plates. First, attach the incisal guide pin to the upper member. To do this, unscrew the top thumb screw on the incisal guide pin and slide as far back as it will go into the opening at the front of the upper member. The plastic washer should rest against the top part of the upper member as demonstrated. Tighten the top thumb screw. This is also a good time to set the position of the incisal guide pin by placing it to the 0 mark, then tighten the thumb screw. The pin can be adjusted in 1.5 millimeter increments by raising or lowering the pin. A nice feature of the pin is that it is designed to follow the arc of closure as it is being raised or lowered. This ensures that the pin will remain in the exact position on the incisal table, thereby maintaining centric position of the pin. Next, place the upper member onto the lower member by ensuring the condyles are seated against the superior and inferior wall, and the incisal guide pin is in contact with the incisal table. Engage the centric latch and attach the elastic retainers. The elastic retainers hold the upper member and lower members together when the centric latch is released and assists in smooth operation during lateral excursions. The Mark 300 has a support rod that, when raised, keeps the upper member parallel to the tabletop, opened up, and rotated back. Now that we have a good understanding of the 3 different models from the 300 series, let's continue our discussion for using the instrument with a face bow registration. In order to achieve the highest level of success of patient care for restorative cases, it is recommended that you include the taking of a face bow registration as part of your diagnostic and treatment planning process. Identifying the parts of the slide-matic face bow. Using the slide-matic face bow in combination with the Mark 300 series articulator will provide you with valuable information and highly predictable results. It is an excellent tool for communicating with your laboratory technician regarding relationship of the maxillary dentition to the horizontal reference plane, so the maxillary cast may be mounted in the articulator in the correct anatomical position. Using the slide-matic face bow is fast and easy. It's so easy that some clinicians have trained their auxiliary staff how to make an accurate Facebook registration. Let's look at the Slidematic Facebook to become familiar with the parts you'll be working with. The Slidematic Facebook features the unique speed slide gear mechanism. This makes it very easy to assemble the bow on the patient. The right and left arms of the measuring bow are geared to precise equidistant movement from the center of the bow. You'll notice a scale on the measuring bow. This represents the patient's intercondylar distance and can be disregarded unless you're using a fully adjustable articulator. The intercondylar distance on the Mark 300 series articulator is fixed at 110 millimeters, which is the industry standard. We will be using the external auditory meatus as a reference point for determining the arbitrary hinge axis location. The Slidematic Facebook has a built-in reference pointer, which aligns the bow with the horizontal reference plane. This plane is established by using the reference plane locator to locate a position on the face, then using the reference plane marker to make a small mark. This small mark is our third point of reference. The Slidematic also has a built-in sight that can be used to view the anterior reference point. The Slidematic Facebook comes with two bubble levels that you can attach to the ear bow that will simplify and ensure you have the Facebook level with the horizon. This Facebook cannot be directly mounted on the articulator when mounting the maxillary cast. Because of this design, the Slidematic is considered to be an indirect mounting Facebook. This design allows you to separate the transfer jig assembly from the measuring bow. Then, by using the articulator index provided, the record can be transferred to the articulator for a quick and accurate Facebook transfer. The articulator index positions the bite fork in exactly the same position and distance from the condyles as was captured in the mouth. This also places the mounted casts in the center of the articulator. The bite fork with a notch cut into the top side. This notch serves as a guide for centering the bite fork between the central incisors.
Now that you understand the parts of the Facebook and how each piece is used to make a Facebook registration, you can begin the actual process of a Facebook registration. Time is money, and time devoted to a Facebook transfer will more than repay itself with less occlusal correction at the chair, less patient embarrassment, and the satisfaction of knowing you have done your best for dental health. To many practitioners, making a Facebook registration may seem like a difficult task that takes specialized training. But if you look closely at the procedure, you will find it very easily done. The purpose of a Facebook record is to position the cast so the midline of the teeth and the face is perpendicular to the floor or to the lab tabletop, and the left and right occlusal plane of the final restorations to be leveled with the horizon. In addition, it will help to decrease the errors at the occlusal surfaces in case of increasing or decreasing the occlusal vertical dimension. For some patients, it might be a little intimidating because they are not sure of what to expect. I highly recommend that you explain the process for obtaining a Facebook registration, and if possible, have the patient assist you. When they feel they have some control in the process, they are more cooperative. Only ask for assistance if you feel they are up to the task and not hindering the process.
Making the Facebook record. The first and most important step in Facebook registration is being prepared. Have your armamentarium laid out and ready for the procedure. Being prepared will give you confidence and put your patient at ease. Mark the anterior reference point on the patient's right side using the reference plane locator and marker. The point is 43 millimeters above the incisal edge of the right central or lateral incisor. On an edentulous patient, measure up from the lower border of the upper lip when it is in repose. There are several materials available to record the cusp tips of the maxillary teeth on the face bow bite fork. For this demonstration, we will use polyvinyl siloxane with an appropriate set time. The bite fork has a notch cut into the top side, which serves as a guide for centering the bite fork between the central incisors. Whichever material you choose, make sure you apply it evenly across the top of the bite fork. If you are using a flowable material, extrude enough to fill in both sides of the fork to help lock the material in place. With the bite fork arm to the patient's right, place the fork in the mouth, aligning the patient's midline with the index notch. Our goal is to obtain a light indexing of the patient's maxillary arch. Hold in place until the material has started to set. Some clinicians will use a cotton roll and have the patient bite down slightly while the material completely sets. When the material has set, remove the bite fork and inspect the registration for any soft tissue or deep occlusal registrations. Any excess can be trimmed away with a barred Parker blade. This is important because any interference between the hard cast and the bite registration material will produce an inaccurate mounting. Once you are confident that you have an accurate occlusal index, place the bite fork back against the maxillary teeth. You can now begin attaching the face bow to the measuring bow. Start by attaching the vertical shaft of the transfer jig assembly to the measuring bow. You should position the jig with the clamp marked number 2 on the patient's right. The vertical shaft has a flattened side, or D shape, which will only fit into the measuring bow one way. Tighten the finger screw on the front of the measuring bow to secure the transfer jig in place. This also avoids any unwanted movement. Loosen the finger screws on the clamps marked number 1 and number 2 on the vertical shaft. A good indication that you have the transfer jig assembly on correctly is when you place the clamps in your hand, and as you are looking at the ear bow from the front, you should see the number 2 clamp and the number 1 clamp in that order. With your thumb, loosen the center wheel on the front end of the measuring bow and slide the bow open to accommodate the width of the patient's face. Assemble the face bow on the patient by guiding the bite fork arm through the hole in clamp number 2. As you are performing this procedure, slightly raise the back end of the ear bow up towards you. This will ensure that you don't accidentally touch the patient's face with the earpieces as you are preparing to slide the arm of the bite fork into clamp number 2. Have the assistant or patient place the measuring bow earpieces into the auditory meatus. Once you have the ear bow positioned and the bite fork is securely inside clamp number 2, tighten the center wheel on the measuring bow and loosen the finger screw on the anterior reference pointer. Using a slow and careful motion, position the pointer toward the red mark and secure it. Place your middle finger of your left hand underneath the base of the vertical rod. Using your thumb and pointer finger, you can now adjust the height of the ear bow so that the pointer or sight aligns precisely with the anterior reference point, and firmly tighten clamp number 1. Only gently tighten clamp number 2. As soon as you have the position of the face bow in correct relationship to the patient's third point of reference, you can return the pointer to the top of the measuring bow and secure it in place. When tightening clamps number 1 and number 2, care must be taken not to torque the bow to either side by having the vertical shaft rest on the fingers as is being demonstrated. The patient's intercondylar distance is the measurement indicated on the scale. Record this measurement only if you are using a fully adjustable articulator. Some clinicians have the patient stand with their head parallel to the floor. Observe the patient from the front and side to verify the face bow is aligned horizontally, either with the pupils or with the floor. A straight object could be used to verify horizontal position with the pupils. For added convenience, Whip Mix provides two face bow bubble levels that you can attach to your Slide-Matic face bow that will ensure the ear bow is level with the horizon. The levels come with a self-adhesive backing used to attach to the face bow. It is recommended that you place it in the top center of the black gearbox. A second level can be used to verify the sagittal plane. If a slight adjustment is needed, then loosen clamp number 2 and make the adjustment. If no adjustment is needed, support the ear bow and securely tighten clamp number 2. Removing the face bow registration. To remove the face bow, loosen the center wheel on the measuring bow. Slide the bow open and remove the entire face bow from the patient. Detach the transfer jig from the measuring bow by loosening the finger screw as demonstrated. Once removed from the patient, check to ensure the clamps are securely tightened. Follow these steps. Remove the transfer jig from the ear bow by loosening the screw on front of the bow. Hold onto the rod that is in clamp number 1 and tighten clamp number 1 firmly. Then, grasp the bite fork stem and firmly tighten clamp number 2. Having completed the procedures involving the patient, the bite fork assembly may be labeled with the patient's name and set aside until it is ready to be used to mount the maxillary cast on the articulator. This will be demonstrated later. One of the biggest advantages of the indirect style face bow is the availability for immediate reuse if necessary. After proper asepsis techniques have been applied, the measuring bow portion can be used with a new transfer jig assembly for the next patient. Sterilize the bite fork before each use. Only the bite fork, vertical shaft, and earpieces can be sterilized in an autoclave except for the black finger screws on the number 1 and number 2 clamps. Remove the finger screws and spacers before autoclaving or use cold sterilization. For complete sterilization procedures, follow CDC guidelines. Mounting the maxillary cast using the face bow registration. An advantage of using the Dinar Slide-Matic face bow is that multiple transfer jigs may be used with only one measuring bow. In most cases, the mounting of the maxillary cast can be delegated to the laboratory or auxiliary team member, resulting in a completely accurate transfer and maxillary cast mounting. The laboratory can attach an articulator index to its own Dinar articulator and mount the maxillary cast using only the bite fork assembly from the dental office. Each articulator index positions the bite fork assembly on any Dinar articulator so that the relationship with the condyles recorded on the patient is accurately reproduced on the articulator. Mounting the casts on the articulator will go much smoother if you have prepared to have the following items available for this procedure. The items needed will include articulator and face bow registration, mounting plates, articulator index, maxillary cast support, mixing bowl with spatula, mounting stone and water. We're going to mount the casts that have been generated from the diagnostic impressions. 2 stone casts have been poured and trimmed. It is recommended that you score the base of the cast to create a surface that will aid in retention between the mounting stone to adhere to the base of the cast. It is also a good idea to wet the base prior to adding the stone to aid in stone adhesion. The articulator settings can be at an average position for mounting the maxillary cast. Engage the centric latch. Attach the elastic straps. The key to interchangeability is ensuring that the surface between the mounting plate and the articulator, where the 2 parts come in contact, should be absolutely clean and free of debris. Attach a mounting plate to the upper member. Verify that the incisal guide pin is set to the 0 mark. Remove the white plastic incisal table and attach the articulator index. Place the cast into the registration record. Check to ensure the cast seats completely on the bite registration record. Remove any nodules that are causing interferences. Insert the transfer jig assembly into the articulator index. Make sure the rod is completely seated. Lock the transfer jig assembly in place using the finger screw. Attach the maxillary cast support to the lower member of the articulator and adjust the height of the cross arms until it makes light contact underneath the bite fork. Check for clearance between the mounting plate and the base of the maxillary cast. There may be instances where you have a large space between the base of the cast and the bottom of the mounting plate. In this instance, it is recommended that you use a two-step mounting technique. In this technique, you mix enough stone to create a bond between the mounting plate and base of the cast. This technique will ensure that you minimize the expansion of the stone. It will also help you control working with the stone. Add pre-measured water and correctly weighed mounting stone to the rubber bowl and mix, according to the manufacturer's instructions. After proper mixing time, add a small amount of mounting stone to the base of the cast and to the mounting plate. Ensure to fill the grooves in the mounting plate to lock the stone in place. Mounting stone has a preset working time before it starts its setting time. You should have your mounting completed before the setting time starts. Once you have added the stone to the base of the cast and to the mounting plate, close the articulator to bring the two halves together. Make sure the incisal pin touches the top of the articulator index. Note, make sure the cast remains in contact with the bite registration and that the fork does not flex while closing. Allow the mounting stone to set according to the manufacturer's instructions. After the stone is set, you can safely remove the face bow fork support, the transfer jig assembly, and the articulator index from the articulator. Replace the plastic incisal guide table. Mounting the casts on the articulator will go much smoother if you have prearranged to have the following items available for this procedure. The items needed will include articulator, mounting plate, centric bite record or maximum intercuspation record, mixing bowl, spatula, mounting stone and water, coat hanger wire, glue gun, marking pen, and a millimeter ruler. A CR or MIP bite record should be used to mount the mandibular cast. Mounting the mandibular cast. Attach a mounting plate to the lower member of the articulator. With the maxillary cast attached to the articulator and the centric latch engaged, rotate the upper member of the articulator back until the upper member rests on the support pin. Check to see that the bite record seats completely onto the occlusal surfaces of the casts. You'll have to remove any nodules causing interferences. A recommended procedure is to place one dot on the maxillary and mandibular casts. Using a millimeter ruler or a metal caliper measuring gauge, note the distance between the two dots without the record in place and record. Next, place the record on the maxillary cast and bring the mandibular cast into contact. Measure the distance between these two dots and note the difference between these two readings. The increase in the distance between the measurements is how much you'll need to adjust the incisal pin to accommodate for the thickness of the bite record. Adjust the incisal pin to accommodate the increased vertical distance caused by the thickness of the bite record. You can also use the recommended averages for taking bite records. This can vary between manufacturers, but it is normally between 3 and 5 millimeters. As mentioned earlier with the maxillary cast mounting, it is recommended that you score the base of the cast to create a surface that will aid in retention between the mounting stone to adhere to the base of the cast. It is also a good idea to wet the base prior to adding stone to aid in stone adhesion. It is important to stabilize the position of the casts to avoid any movement between the casts and bite record. For this demonstration, we are using coat hanger wire. You can also use tongue blades or even long shank burrs. Secure the items using compound or hot glue gun. Once you have the cast secured in the record, check for the space between the base of the mandibular cast and the mounting plate. Engage the centric latch. Using mounting stone and following the procedure mentioned earlier, mount the mandibular cast to the mounting plate on the articulator. After both casts have been mounted and the stone has reached its final set, you can remove the coat hanger wires and the CR or MIP record. Loosen the thumb screw on the incisal pin and allow the pin to drop until it touches the table. It should be at or very near the 0 mark.
To create a highly professional appearance to your mounting, we have removed any excess mounting stone, and with the use of sandpaper under running water, a smoother finish, as seen here, is achieved.
Set the pin to the first point of contact, hence the centric relation record has been recorded. To check for any slides or occlusal discrepancies, raise the pin, unlock the centric latch, close the articulator to the first point of contact and verify if a slide is present. The same slide that was identified in the patient during the clinical exam should be reproduced on the articulator. Setting immediate side shift. The Mark 330 has the ability to incorporate immediate side shift or Bennett shift. There are conflicting beliefs about patients' ability to actually produce immediate side shift. Only through the use of a mechanical type of mandibular recording device like the KDX Compact 2, the clinician can determine if immediate side shift is present. If immediate side shift is found to be present, then follow these steps for programming the Mark 330. Loosen the lock knob located on the top of the fossa guide. Using the scales located on the top of the fossa element and on the sliding bar, you can precisely set the amount of immediate and lateral side shift needed. For immediate side shift, the scales on the upper portion are calibrated in 0.5 millimeter increments and at 1 millimeter increments on the lower portion. The progressive side shift or Bennett angle is used to follow the path the orbiting condyle follows on the medial wall of the fossa as it orbits around the rotating condyle. The scale of the progressive side shift is calibrated from 5 to 15 degrees with increments of 5 degrees. To set the immediate side shift, loosen the thumb screws and by sliding the scale align the marks of the lower scale with either the long marks of the upper scale for shifts of 1 or 2 millimeters or with the smaller marks for shifts of 0.5 or 1.5 millimeters. The Mark 320 and 330 incorporate the feature of setting the protrusive angle or condylar inclination. After the casts have been mounted using a centric bite record, the articulator can now be programmed to incorporate additional movements. One of the most common features set on a semi-adjustable articulator is the protrusive or condylar inclination setting. This is the angle of the fossa in relation to the occlusal plane. The protrusive bite record is made with the mandible advanced 5 to 10 millimeters. Inspect the protrusive bite record and casts for any possible interference with the cast's seating. Place the record on the cast and bring the cast into contact with the record. Unlock the centric latch. Release the elastics and loosen the protrusive adjustment thumb screw. Bring the mandibular cast to the protrusive record. Place the articulator on the tabletop. With one hand, press firmly on the upper member, while with the other hand, adjust the condylar element until the top of the element contacts the top of the condylar ball. Note the protrusive angle on the condylar inclination scale. The condylar inclination scale is calibrated in increments of 5 degrees and can be set from 0 to 60 degrees. Tighten the protrusive adjustment screw. Set the protrusive angle for both sides. The patient's condylar inclination has been accurately transferred to the articulator. Note that the protrusive record permitted the ball to move away from the top of the condylar element during this procedure.
In summary, the use of dental articulators can truly enhance your private practice by improving the accuracy while decreasing valuable chairside time. The articulator and its earbow are an excellent tool for patient education, and they help in patient acceptance of the formulated treatment plan. The DNR 300 series provide a viable and necessary adjunct to your clinical practice in constructing successful dental restorations.
For your convenience, the DNR line offers a wide variety of articulator and facebow accessories. The following is a list of those accessories. Item number 200-11577. Disposable mounting plates specifically for the Mark 300 series articulator with 3-point contact, 20-pack. Item number 200-11578. Disposable mounting plates specifically for the Mark 300 series articulator with 3-point contact, 100-pack. Item number 110210-5. Simplified Occlusal Plane Analyzer. Designed for analyzing the curve of Spee and the curve of Wilson. Item number 110357. Occlusal Check. Detects occlusal interference of restorations while they are still on the articulator. Easy to use. When the pin locks into the slot, the restoration is in the correct height. Item number 110778. Anterior Determiner Pin. Shaped like an anterior tooth to allow for more precise fabrication of custom incisal guide tables. Used with a custom flat incisal table. Item number 112027. Short round incisal pin with support. This pin is the standard incisal pin that comes with the purchase of any DNR articulator. Item number 110509. Tapered pin with support. This pin has a tapered end that is intended to be used with the adjustable guide table. Item number 200080. Articulator Index. The articulator index is used to transfer the facebow registration over to the articulator for mounting the maxillary cast. Item number 200016-1. Shaft Assembly. The shaft assembly is part of the facebow. It holds the bite fork and is attached to the earbow during the bite registration procedure. Item number 200016-2. 007, Bite Fork Shaft Assembly. The bite fork shaft assembly is part of the face bow. It is the shaft assembly with a bite fork included. Item number 200009-1, Complete Transfer Jig Assembly. The Complete Transfer Jig Assembly consists of the shaft assembly, bite fork, and articulator index. Item number 200029, Slide-Matic Bite Fork. This bite fork comes standard with the Slide-Matic face bow. It is for the dentulous patient. Item number 200030, Slide-Matic Bite Fork. This bite fork is for the Slide-Matic face bow and is for the edentulous patient. Item number 3266, Reference Plane Locator. The reference plane locator is a tool used to accurately pinpoint a position on the facial surface of the skin to align the ear bow on the horizontal axis. Item number 003401-000, Maxillary Cast Support. The maxillary cast support supports the face bow fork while mounting the maxillary cast. Item number 20011670, Mark 300 Verification Gauge. Verification gauges are a quick and easy way to verify that your Dinar Mark 300 series articulators are in calibration. With articulators in calibration, you may transfer the casts between compatible articulators with confidence.
Item number 300163, Dawson Fossa Guide Pin. Used to simplify carving the occlusal fossae of lower posterior teeth. Item number 180036, CentraCheck for the Mark 300 series. The CentraCheck system uses a set of precision recording inserts which provides verification of accurate centric relation records and comparative condylar joint position.
Introducing the new Mark 300 Verification Gauge. The Mark 300 Verification Gauge is a quick and easy way to verify that your Mark 300 series articulators are in calibration. With your articulators in calibration, you can transfer casts between articulators with confidence. Attach the gauge as demonstrated in the instruction manual. Using the verification pin, simply let it drop through each of the two holes. If you hear the pin drop, your articulator is in calibration. If you find the articulator out of calibration, as demonstrated, follow the instructions to determine if your instrument needs to be returned for a factory repair. For questions or to place an order, contact us at www.whipmix.com or call 1-800-626-5651, option 2 for customer service.